I'm Dr. Alexander Millman, and today we're going to talk about the connection of oral diseases to our overall systemic diseases. What triggered this question is I recently had a few patients who were treated in emergency room and in physician's office for something that is dentally related. For example, one of the patients ended up in the emergency room with a very low white blood count, which is an indication of infection, and physicians couldn't figure out where the infection was coming from. The patient had a very severe periodontal disease. And the way periodontal disease contributes to our overall systemic infection can be viewed if you look at the tooth. We are brushing this top portion of the tooth when we brush our teeth. This area, if you don't go to a dentist on a regular basis, gets filled with bacteria. Bacteria calcifies, and this is how bacteria enters our bloodstream and is taken throughout our entire body. So that's one way how we can reduce overall infection to our body. The other way the infections happen is through the tooth. So if a patient doesn't go on a regular basis to a dentist, bacteria can get into the canal, and through the canal can cause an abscess. So I had another patient recently who was scheduled for sinus surgery because this abscess was up against the sinuses, and the physicians couldn't figure out that it's coming from the tooth, so he was scheduled for sinus surgery for something that's coming from a tooth-related issue. So if you haven't had a dental checkup in over a year, I would strongly encourage that you see your dentist and get a checkup and a follow-up. And if you have any questions for me, please feel free to call our office or to email